All right. Well, welcome everyone. My name's Elliot Williams, and I'm the training manager at the National Press Club Journalism Institute. Thank you so much for spending your time with us this Tuesday. Just a few things to note before we begin. We are recording this program, and to create a safe space, we just ask that you disable any third-party assistants or AI bots that might be recording this session. We just want to remind you that closed captioning is available in the navigation tool at the bottom of your screens. And highlights in our recording will appear on our website and in our daily newsletter for journalists, which you can subscribe to using the link in the chat. And as participants, we'll also send out the recording after we're finished today. Today's program is part of our Public Health Reporting Fellowship, which is supported by the Common Health Coalition. The fellowship offers training and financial support for mid-career journalists to complete reporting projects focused on the intersection of public health policy and healthcare delivery. Before we get started, let me introduce our wonderful guest speakers today. Julie Rovner is the Chief Washington Correspondent for KFF Health News. She hosts the weekly health policy news podcast, What the Health? I love that name. She spent 16 years as a health policy correspondent for NPR, where she helped lead the network's coverage of the passage and implementation of the Affordable Care Act. Julie's also the author of the critically praised reference book, Healthcare, Politics, and Policy A to Z, now in its third edition. Welcome, Julie.
Thank you.
Welcome back, I should say. And Amanda Seitz is a health policy reporter, also for KFF Health News, and a former Institute Public Health Reporting Fellow. She's part of our inaugural class last year and reported with AP News on the impact of the Trump administration's immigration policies on U.S. public health and how community organizations in Texas are trying to reach migrants to provide health care despite their concerns about deportations and arrests. So that project we will link to in the chat. And from Washington, from here in DC, she covers how federal regulations, laws, and policies impact the health of Americans around the country. And she previously worked as a healthcare policy reporter for AP. She's also reported from local television and newspaper rooms in Ohio and Wisconsin in the early years of her career. And really excited to have you with us, Amanda. Thanks for joining.
Thank you so much for having me.
Of course. And today, with Julie and Amanda's help, we will focus on translating data and jargon for broad audiences, making tough editorial judgments when covering major public health issues, and building trust in a fractured media environment. We ask that you remain respectful of others in this group and the time we're sharing this afternoon. And then we invite you to also submit questions using the Q&A feature that should be in the toolbar in the bottom of your screens. If you don't see it, click that More button, and you should see it there. The feature allows you to ask questions either with your name attached or anonymously if you so choose. And approved questions will appear for everyone. So just be aware of that, and your questions will be addressed through the program. We'll try our best to get to as many as we can. And again, if you're just joining in, let us know where you're tuning in from. So with that, I'd like to kick off with a few questions to get us started. So, Julie, Amanda, can you just tell us a bit about KFF Health News, who you all try to reach with your journalism, and then maybe a bit about what you each do specifically? Julie, we'll start with you.
Okay, KFF Health News is a national newsroom. We have reporters in, I should know how many states, a lot of states now. We have reporters around the country. Our main newsroom is here in Washington, D.C. We partner with other organizations. That's our main distribution method. So we give away our audio and print and video stories, and we work with other news organizations. We just had a big project that we just finished with the AP. And try to basically help people understand health policy and the trade-offs involved and the decisions that need to be made. We're an arm of what used to be the Kaiser Family Foundation, now just renamed KFF. So we are one of the operating entities at KFF, which does policy analysis and polling.
Wonderful. Thank you. And Amanda, tell me a bit about what your role is and what you do at KFF.
Yeah, so I am kind of roving all throughout DC all the time. I might be on the Hill one day, might be covering a press conference. at the Humphrey Building. So it just really depends what's going on, where the day takes me. I work, as Julie said, with reporters across the country to really translate how, the Rural Health Transformation Fund, for example, might impact communities on the ground, or what RFK Jr.'s Maha movement in Ohio is thinking about the latest thing that the Trump administration did. So that's kind of my role here.
Wonderful. Well, I want to dive in a little bit on, what your specific beats are and your reporting. So, Julie, I'm curious if you could tell us a bit about your vetting process for booking guests. Are you aiming for any specific outcome when you select someone to join your podcast?
It depends. Having done this now for 40 years, I know most of my guests. A lot of people will have books and be out on book tours and sort of a good chance to talk to them. It's like, oh, there's somebody who would be interesting for our audience. Basically, I'm just trying to bring the audience, someone who can help them with an understanding of health policy. People who I'm pretty sure are well spoken. We're not. I get so many pitches for the latest medical advance, and that's not what we do. We really do policy. There's plenty to be had just in the policy realm. But I'm lucky just when the Ebola outbreak started to actually, I guess first the hantavirus outbreak and then the Ebola outbreak, I was able to call in Celine Gounder, who I'm sure people have seen on TV many times, who's an infectious disease doctor, but is also our KFF Health News editor at large for public health. So it's like I have colleagues here that I can just grab and it's like, will you come talk on the podcast? So, sometimes it's just a matter of reaching out and getting the right person for the time. But basically, it's people who I feel like have something to say that will help the general public better understand what's going on in health policy.
I feel like this will be a theme throughout this conversation of putting the audience first and thinking about them when reporting and booking guests. So that makes a lot of sense. I feel like you also do a really good job making some wonky topics interesting for your audience and general public. You do this in your collaboration with WAMU's Health Hub and in your columns. I'm curious how you balance shining a light on major issues without sparking panic. I'm thinking about your recent interview with David Blumenthal, called Acknowledging Healthcare's Great Divide, where you explore the dynamics that make fixing the nation's healthcare system so difficult. I'm thinking about a headline like that might scare people, but you really got into the nitty-gritty and explained a lot of things. So how do you kind of balance that?
I always like to kind of take the long view. I've covered a lot of issues that have taken many years to play out. I grew up here in Washington, D.C. I know how long things take. So I think of myself as sort of the hand holder in chief,
Hmm.
bring people along the way with me and sort of remind them that big things can happen, but they don't usually happen overnight here in Washington.
That is so true. And I think I'm going to steal that hand holder in chief. That's great. Amanda, a question for you. So I do want to highlight your recent feature that came out in late May about the gaps in Trump's Rural Health Fund and its impact in North Carolina specifically. On the surface, a $50 billion fund for rural health sounds amazing. But what tipped you off that the fund might not address the healthcare gaps in Martin County specifically, where you started that reporting? And can you tell me a bit about how you divided up that or approached that reporting?
Well, we had been hearing a lot from, Sarah Jane Tripple, who covers rural health, she had been hearing a lot from her own sources that this fund was really not going to go directly into the hands of a lot of patients, hospitals, sort of thing to help bolster care in communities. That there are a lot of firms, as is often the case with healthcare, that there are a lot of firms that are either selling technology, equipment that they're going to benefit. So I had actually been following Martin County back when I was at the AP, when I first heard that then President Joe Biden was going to make healthcare like a really big point in his campaign. I had decided then that I wanted to do a story on what a community that recently lost its hospital like how they think about this in a very divided part of the country. So I narrowed down counties that had recently lost their hospital and kind of went from there. And Martin County really checked off all the boxes in the sense that its hospital had just closed. It's a really politically divided area. It's a swing district. So I went there, spent a lot of time with some folks on the ground just to learn a little bit about what the impact of the hospital's closure had on the community. And I was really familiar with Martin County from that reporting. So Sarah Jane and I were talking about like, okay, how do we look at the impact of this rural health fund? We know, I knew from my sources that there were a lot of Republicans were going to be playing up this fund, right, in their election cycle this year. Like, how do we, as they're talking about this fund and saying it's going to do all these great things, how do we kind of, frankly, fact check that? Like, is it going to have this impact that they say it's going to have? And Sarah Jane and I started talking about Martin County, and I said, hey, if there's one place that I know of that like really could stand to benefit from this money, it would be this county that I reported on years ago. And so Sarah Jane went down there, and she was just really shocked at what she saw with the wait times for the hospitals that remain open. And it really just became this compelling story of this area that could absolutely stand to benefit from this money and isn't going to see the help that they need from it.
I think what's really, I mean, there's several things that are impressive about that, but I think what stands out to me is that you built on previous reporting and relationships that you had built years ago. And I think, journalists sometimes get knocked for picking something out of a hat and then dropping in and covering it, but you had already kind of been focused on that county. So just taking that away from what you said. I think we have a question that I want to get to from our Q&A. Many people are widening their idea of climate coverage and saying all stories are climate stories. And I wonder, it seems like many stories can also be health stories, but the current journalism economy is not always supportive of widening that context. Where do you see money for more public health stories? And I'm not sure if they're asking about where should money go to support public health stories, or maybe they're asking, maybe Sally, you can clarify a bit, but maybe it's sort of a question about like how do we make sure that important health stories are funded so that we can widen the scope of what counts as like a health story.
I feel like we have a pretty broad view of health. I mean, I've been talking a lot on podcasts about how
Mm,
housing is, increasingly a health story. That more and more, both in terms of sort of land use, pollution, climate change, where people live, people who are unhoused, how they get medical care, how they are able to continue to care for themselves. So there are a lot of, social problems that very neatly fall into the health and public health category. Childcare, obviously immigration in a whole number of ways, both in terms of the workforce and in terms of people being able to get care, people being afraid to get care. So there sort of all the big hot button issues intersect with health, and I consider, part of my portfolio as a health policy reporter.
Yeah,
definitely.
there's really always a health angle. Our colleague, I think Neri Patini, has done an excellent job of covering mental health through the lens of all these other issues, housing, loneliness. She's just looking at every facet of a person's life that could lead to bad mental health outcomes. But you hear that too when you talk to doctors, health providers, that there's so much that goes into our health outcomes and what we're covering that really any topic has a health angle, in my opinion.
Absolutely. And Sally, who asked the question and kind of echoed that, talking about, housing, like every story could be a health story. Do you have any thoughts on how to get that kind of reporting funded? Of course, we have this fellowship as an example of that, but are you seeing any initiatives similar to that, or where could funding go to kind of support this type of reporting?
I mean, I do think even outlets that sort of, are more narrowly focused are recognizing that there are health elements to these things. I mean, there are a lot of climate change and a lot of environmental outlets. There are outlets that focus on prisons and the whole, sort of the
Mm,
criminal industrial complex, if you will. Those of all have, health links to them. And, I think also, we work with other organizations that maybe have different kinds of reporting focuses to bring the health element to them, and they can bring sort of their elements to our health reporting. So I think there's a lot of opportunity for collaborations, even within organizations that are, maybe funded to look at one specific thing. I know that, tech is increasingly a health story, both mental health and physical health, and obviously AI. So, almost everything that has its own vertical has a health angle to it.
absolutely. I think it's also important, Julie, you mentioned this at the top, that your stories are kind of free to share. And like I love how if I look up your reporting, I find it on local outlets across the country. So I think that's also really important, that collaboration. Yeah, I want to get a little bit into, Amanda, you mentioned fact checking and that sort of being sometimes the impetus for the reporting that you do. I'm curious, when you encounter a false narrative around a health issue, how do you decide whether covering it will debunk that issue or unintentionally amplify it, particularly when it has the potential to spread or change rapidly?
Well, I always think that, you don't want to be the person giving a falsehood its biggest platform, right? So you should be looking at how many, like when I used to do just fact checking, I was a fact checker reporter for a while. It would be looking at how many shares something had, what outlets were picking it up. That's changed a little bit just with the analytics of social media and everything. But look at who's amplifying it. Certainly, if the president, if the secretary is saying something, that is going to give the fact check potentially more weight, more importance. I think that you also want to, like, Secretary Kennedy is difficult because you could listen to him talk for a few minutes and he will say, 10 to 15 inaccurate things in just a short amount of time. So you really want to pick what thing he said that is relevant to either like policy conversations that are being had or the news of the day. Like, again, when I've listened to him speak, especially at the cabinet meetings, he'll really go off the cuff there. He'll bring up like just a lot of off the wall things, and you don't necessarily want to spend all your time on something that might not come up again or isn't really relevant to the discussion of the day. So I think those are all things that you're considering, especially if you're under a tight deadline, what you are going to fact check.
That makes sense. Kind of similarly, I know in some of our prep for this, we talked about quoting versus, paraphrasing for just like, editorial. I'm talking about like line editing almost. How do you decide whether to quote someone directly, an official, versus, hey, we're going to actually explain this and not quote, exactly what they said?
Yeah, that's a really tricky one. First, I don't think we should be in the business of protecting audiences from what our public officials say. I think there used to be sort of this reflex of, oh, if they say something really egregious, we don't want to put that in print, for example. But I think it's our job to report what public officials are saying and then either add valuable and necessary facts or context to what they said. I would say the first step, though, is to make sure that you can fact check what they're saying, especially when you're on deadline. There's just some times where they say something really wild and you're like, that sounds off, but I don't know if I can piece together all of the facts that I need to either debunk it or add the necessary context. So that, I think, is an important first step. I think, I was traveling with the secretary a couple weeks ago, and this is a really good example, I think, of how we can play a role in, again, adding that context. He said he was at this event and he said, quote, the death rate among kids from hepatitis B is 1 in 16 million. And some outlets quoted him directly on that and didn't add anything else to that. And I think what was really missing there is the like just one little sentence that says, okay, childhood deaths from hepatitis B might be rare, but thousands of children before the vaccine was available developed hepatitis B infections every year, and they were sentenced to a lifetime of side effects from an incurable disease that can cause cancer or liver failure. Sometimes it's just a matter of like adding that little sentence that really provides a lot for the reader to consider. So that's, I err on the side of if I don't have the resources to provide that necessary context and I'm unsure of if what they said is true, then I might not include it in my copy. But I also don't want to be protecting the audience from crazy things that our politicians say either.
Definitely. Julie, just to kind of follow up on that, I imagine it can be difficult in a podcast to do some of that fact checking. Are you kind of doing any of that in real time with your guests, or how do you think about kind of adding context to what's said? Are you kind of asking your guests to help out with, debunking misinformation or clarifying what might be out there in the news?
Yes, all the time. I mean, obviously the podcast is taped, it's not live, so we have an
Right.
opportunity to go back and edit if we need to. And in fact, there's an editor who, occasionally will grab us, if at the end it's like, oh, well, you said Medicare when you meant Medicaid kind of thing. So we get to fix those things ourselves. But, for me, it's a matter sometimes of, do I want to use tape of somebody saying something, or do I just want to quote them, or do I just want to paraphrase it? And that's what I think what you were talking about before. You don't want to be the person who platforms some things that to be untrue. Although sometimes I mean, there's a piece, I'm trying to remember what it was. I used a piece of tape from Dr. Oz a couple of weeks ago because it was one of those things that you just needed to hear coming out of his mouth. I honestly can't remember what it was
I
at
think
this
it was the
point, but
fertility, right, Julie? The fertility
probably, yeah. I just,
on your
a
baby.
case. Yeah, and that was, I don't want to use the tape that everybody uses because I don't, we have a limited amount of time, and I feel like they either you don't need it to understand the context of what we're talking about, or everybody's heard it. I sort of get annoyed at podcasts that, I've heard the president say this 15 times. I don't need to hear him say it again. Just remind me what he said and move on. So there's a lot of that, but it is, occasionally it's like, yeah, we really need to play this clip because people really need to hear this. And that's just part of the ongoing editorial process of, what's going to serve your readers and listeners the best and help them understand, the point you're trying to make.
Definitely. We have a question, and I just want to remind folks who maybe signed in a little late that we do have a Q&A function. And if you can't find that, feel free to throw your question in the chat. But Audrey wants to know, what are some public health topics or stories that you'd like to cover but haven't been able to, and why? And what do you think are some of the underreported public health stories or topics?
Well, I'd like to see my hobby is workforce development, healthcare workforce, the future of the healthcare workforce, and I do feel like that's being impacted on a whole number of levels by this administration, everything from, capping student loans to making it harder to get visas, to, even this rural health transformation fund. I mean, there are a lot of to abortion bans that are keeping sort of young. It's not just people studying to be OBGYNs, but, medical students who are of childbearing age and don't necessarily want to go live in a state that has an abortion ban, not because they think they might want an abortion, but because they think they might get pregnant and they're worried about what happens if they have, complications of the pregnancy, in a place where there are now fewer and fewer OBGYN. So I think there's a whole lot of issues that are getting tangled up in the healthcare workforce. And I think that that's just sort of a place that's ripe for more reporting.
I was also going to say the fallout from the abortion bans. That was just something I was able to cover a lot more during the Biden years, just because simply there was not as much news breaking every day, and it's still such an important topic. We're still seeing so much fallout from those expands, and there's a lot of work to be done. I think the other topic I would say that has really piqued my interest is screen time. And I don't know that I've been thinking of it enough as a health story, but it actually came up recently with some sources I was having lunch with on how, you know, hospitals, providers are seeing a lot of the fallout from children who, you know, have struggled with screen time and been overexposed to it. And I thought that was really, really fascinating and an issue I'd love to dive into more.
Maybe a quick follow-up, and if you need some time to think about this, we can come back to it. But obviously, you have to cover, as you're in part of your jobs, you have to cover some very heavy topics. You have to cover, deficits and health gaps. And are there positive stories? Are there, trends you're seeing, or things that you seek out to kind of balance that and sort of tell people where there are good examples of great public health policy right now? And maybe that's on a local level. What are some of those positive stories and sort of things that are giving you hope as you're covering? So I'll give you a second if you need to think about it, and then we have another question after that.
I would just say, I mean, this isn't a topic. I am admittedly very bad at like picking positive or like solution journalism topics, so I'm not like the best answer on that. But I would say that what brings a lot of positivity into my reporting and how I think about things is when I do get on the ground and meet with real people. I mean, that is just to me like such an uplifting experience every time. You know, the story that I did last year with through the fellowship, going on the ground in Texas and meeting just these really wonderfully dedicated people who were trying to help immigrants get maternal health care. I mean, that was just to see the dedication and to know that there are people who work so hard to help other people is always to me the most uplifting part of the job.
Yeah, I absolutely agree. And I love good news stories, and I am always sort of seeking them out. I mean, particularly, because I'm a policy reporter, people who have found ways to solve problems. I mean, that's always, it's like it's we have so many problems. It's nice when somebody sort of figures out a way to like, oh, here's something that works. And to be able to sort of share that with more people. That those are some of my favorite kinds of stories. Or here's something that might work if we could scale it up. So.
That's got to be a really gratifying moment to be able to
Yes, those
share.
those stories are out there. They are, I won't say few and far between. They are fewer and further between than I would like. Let's
Yeah,
put it that way.
absolutely. I'm curious as how do you decide what level of scientific detail and data is necessary in a story versus like overwhelming? I know you're trying to clarify issues and you need data, you need specific evidence, but how do you kind of strike that balance of not overwhelming your audience?
One thing I learned at 16 years of doing, 3.5 minute radio pieces is that you can basically make one point, and if you're really good, you can make two, and that's it. And even though
Hmm.
you know that there's 20 points, it's like that's just going to have to wait for another story. So I find it sort of useful to break it down that way. It's like, what's the most important point that you want your audience to walk away with, and concentrate on what you need to explain to get that, rather than try to explain the whole world, and which is just going to overwhelm people. It's hard to break it down. Amanda, I know as
Definitely.
a wire service reporter, you probably have the same advice.
Yeah, I think that's spot on. I also think that some of it is a little bit less about how much you do or don't include and more about how you explain it, right? Like, um, you just want to make sure that you're explaining things like you would be your friends over lunch or drinks, like that is when you're dealing with a complicated subject matter, that is how you want to approach that. So it's not that you should less necessarily be leaving important things on the cutting floor, but just that you are really explaining it in a way that is easy to understand.
That
I
makes
like to think
sense.
about explaining it to somebody who's interested in something but not necessarily educated about it.
Hmm. I like that. I'm curious, along those lines, are there examples of storytelling, whether that's following a patient, a health worker, a local community that helped illuminate a broader policy issue? Of course, Amanda, we were talking about the North Carolina story, but I'm curious if You could either talk about that a little bit, or if there are other examples you wanted to provide.
Um, I would just say that, like, every time I reach out to a patient, for example, or a person that is going through the policy change that we're writing about. So the most recent example I would say is the Affordable Care Act, extended subsidies expiring. I learned so much about what people are going through that you can't capture through talking to like lawmakers on the Hill or policy experts, right? Like the types of people who are impacted, for example. Like one of the fun facts that I learned when we were covering the possibility of the subsidies expiring is that farmers were particularly hit by these subsidies expiring because they are small business owners and they too have employees that all rely on this coverage. Barbershop owners were another one where it's just you learn these sort of details that you would not learn. Again, just staying on the Hill and talking to the folks there.
Definitely. Julie, I'm curious if you have any examples. Maybe some of your guests have highlighted what's going on, on the ground or where they are in their work that you thought effectively illuminated a broader policy issue.
Yeah, I mean, I have one of the reasons I do the podcast the way I do is that our panelists are also reporters.
Right.
We have guest interviews, but most of the podcast are reporters talking amongst each other. So I get to, basically just say, what are you finding out, when in your reporting? And I get to sort of lean on other stories that other people have written. The idea behind the podcast is to bring together kind of the health policy news of the week. So I go through, I'm just sort of constantly combing, social media news sites, and I see a lot of, I get a lot of newsletters, and I get a lot of email myself. So I sort of put together, and it's the stories about individual people that are really the ones I think that help people relate to a policy problem. And I can say certainly in the reproductive health realm, the last few years, it's these individual stories about women that in situations that maybe lawmakers didn't think about. There's a story, I'll give a little preview this week, that's sort of amazing Huffington Post story about a pregnancy test that seems to be coming up with an awful lot of false positives. And what's happening is that women are getting these positive pregnancy tests and scheduling abortions and traveling to other states, only discover that they're not actually pregnant.
Hmm.
It's a pretty wild story. And again, through the eyes of actual patients and actual doctors, it's pretty vivid. So yeah, I mean, there you cannot separate. That's one of the reasons I like covering health policy, is that it is a very human story, and it's about individual people, and healthcare affects everyone in a very intimate way. And I am grateful to everybody who's willing to, share their very personal and often painful stories.
Most definitely. Mark, one of our fellows, wants to know, how has the Trump immigration policy affected the healthcare industry in the Northern Mariana Islands, where U.S. territory where he's based? He says their lone hospital has challenges recruiting workers. So hoping you can both speak to what you've seen in your reporting.
Yeah, we've talked a lot about immigration and health policy on the podcast because, as I say, you have everything from people who are here in sort of mixed status families who are afraid to either apply for benefits that they're eligible for or use care, because now that people are, for the last several administrations leading up to this one, healthcare facilities were places that, ICE was not welcome. I mean, because they wanted people who were sick to seek care, particularly people who might have contagious diseases. You didn't want to deter them from seeking care and, hanging around and spreading those contagious diseases to others. That's not the case anymore. So you have, people who are here, and as I say, in some cases legally. You have the problem with healthcare workers. We have a huge immigrant healthcare workforce, everything from doctors to nurses to, to aides, and it does the whole issue with visas, and with again, with the presence of immigration officials in healthcare facilities, affects both the patients and the workers. So it is a huge, huge impact on health. Plus, just the stress from everybody, people who are here legally who are worried about having their visas yanked, or their green cards yanked, or people who came and did all the right things and still are uncertain about their continued status here. So it's a huge issue in healthcare, in both the delivery and the receipt of healthcare services.
Yeah, everything Julie just said. And in addition to that, we're also seeing huge coverage losses as well for people who are here perfectly legally. There have been extraordinary changes to who is eligible for the Affordable Care Act, for Medicaid. So that's another thing that we haven't quite seen all the fallout from yet, but we will continue to. And I think, yeah, the workforce, that I think has been kind of an underreported story in many ways, that just the dire straits that has put a lot of healthcare facilities in as well.
Definitely. Um, we have a question from our Q&A. How do you balance simplifying a scientific story for the audience while also making sure your sources don't feel like you're oversimplifying their expertise, their topic that they care a lot about?
I think, I would suggest, if you have a source that you're worried about that in particular, maybe asking them to explain it to like they would to their family member or a friend, just to like get an idea of how they would talk about it. But I mean, at the end of the day, of course, we want everything to be accurate, but you have to understand that you are going to write about something differently, in a different way than your scientific source would. It's just, they're two very different audiences. And, I've definitely had those conversations with sources where I'm just like, this is a different audience. So.
And these are our skills. That's the expertise that we bring to this, is being able to take these complex things and make them understandable. We're basically translators. That's our job.
I like that. That's a really helpful way to think of it. Another question from one of our fellows. Have you experienced a slowdown in responses to records requests for your health stories from this administration? And how has that affected or changed the way you approach these stories?
I think records requests, especially at the federal level, are always so difficult that, I'm not at all. I mean, this was kind of expected. I think, this wasn't the question, but for me, what has been more surprising is the chilling effect that this administration has had in responses in general, from even beyond records, just getting responses from hospitals on controversial issues that they once responded to, or even universities, like especially last year, the story I was working on Texas and immigrant health. I mean, it was like, good luck finding someone who wants to talk to you on the record about this for the first 6 months of that administration, because no one wanted to put their name on this. I mean, I had people working at hospitals that had told me that they had been told by their administrators to not talk about this issue, not risk their funding in any way. So to me, that's been the biggest, more surprising challenge. I think, like I said, records are always just such a challenge that it was sort of expected that this administration would make it more difficult.
And I will say that every administration since I've been doing this has made it progressively more difficult. I mean, this administration has made it more difficult by, a factor of many, but even Democrats and Republicans seem to have been, they want to sort of choke off the ability to get as much information as possible. It's always been sort of this tug of war between reporters and administration officials. It is obviously worse with this administration.
So it sounds like it's been headed towards this direction for a while, and not making it easier to do your jobs. Well, thank you for that answer. Just sort of on a more personal note, we have a few questions actually about how you remain resilient as a health reporter right now. Of course, you're covering deeply polarizing issues, and that can materialize as harassment, threats. I'm curious how you are taking care of yourselves and your colleagues while navigating that sort of this contentious environment.
It's been hard. I will say, I go out and scream a lot.
Yep.
And I have two dogs and a horse who do help keep me sane and let me sort of unplug from the political fights and sort of think about other things.
Yeah, I think you do just have to set boundaries on, I mean, it's so easy, especially when it's your job to not turn off the news, and especially when it's the news is coming in all forms, all times of the day. But it's just really important, I think, to set those boundaries of, okay, this is, whether I mean, I've actually like set before like blocks on my phone to I can't access, social media during certain hours. That's been really helpful. But and I think sometimes the first step is admitting that you need that break, right? I think especially as reporters, we think like, okay, we have to be up to date all the time on the latest, and it's just not physically possible.
Yeah.
I will
Um,
confess I have listened to White House press briefings from the back of my horse before.
that's
Probably not
impressive.
the healthiest thing.
Wow, and stayed and kept balance. That's amazing. Um, yeah, I mean, it's a really important point. We just want to always emphasize the importance of taking care of yourself. Not just, it's important to take care of your digital security, obviously your physical safety, but also your mental health and supporting one another. It's one of the reasons we have the fellowship and the cohort to provide that support. Um, we're getting to sort of the end here, and I want to just again encourage anyone if you have any final questions, please put those in our Q&A or in the chat. But I'm curious if there's anything you all think that we haven't talked about or anything you wanted to make sure we address before I get to sort of my final questions here. Anything kind of missing from this conversation? Great. Well, I know that Amanda, you mentioned this earlier a bit about how um, some reporters can struggle to add the context that might be helpful with a quote. Are there other common mistakes that you see journalists make when reporting on misinformation in health and medicine, or things that maybe even you made or continue to make in which that if I could do this differently, or tell a younger version of myself not to do this, what are some of those things you'd flag for the journalists on this call?
Yeah, I think especially when you're dealing with health related content. I started at the AP as a fact checking misinformation reporter, really focused on politics. And so often it was really easy to fact check something and say, no, this is wrong. Yes, this is true, sort of thing. And when I found that, like, when I got to covering more health topics, especially during COVID, that that black and white is not as easy to apply in this setting. But that doesn't mean that you don't play a role, right? Like, again, sometimes it is just adding in that little line of context and like, okay, but there's also this thing you consider. And like going back to that example I gave earlier around like hepatitis B, okay, you can, think about it from the perspective of a patient. If you're walking in thinking about getting your child vaccinated, if your doctor says to you, like, I can give you this vaccine, but just so you know, like only 1 in 16 million children die from it, as the secretary said, you're going to go like, why would I bother? But if you add on, okay, but your child might develop this serious infection that could lead to cancer and I can't do anything about it. Like, that's really important context to have, right? Like, that changes the conversation very drastically. So I think that it's just always important to be thinking about, like, what does my reader really, really need to know here, to make an informed decision and be informed in the conversation too.
I think one of the really important things that a lot of reporters sort of don't appreciate is that things change in healthcare and in
Hmm.
science. Things that we think we know, there may be new evidence and it may be the opposite. During COVID, we saw this happening in, really sort of much more intensified and rapid fire times. It's like, here's what we know now. Here's what we know about masks. Oh, well, it turns out this might be better. It wasn't that we were lying before, it's that we have new information. And I think that's particularly with misinformation, that's what's really infuriating to me. It's like, and I sort of get on public health officials too for not being able to communicate this. It's like, from what we know at this moment, this is what we advise. It might change. Stay tuned. That's all you have to say to make people trust you, and I think to win back the trust. And I think a lot of people didn't do that, and there became a lot of black and white stuff, and then said, well, but that turned out not to be true. Well, things turn out not to be true in healthcare all the time. um, so that's it's science. People are continually finding new evidence and finding new things and discovering things that we thought used to be healthy. We used to put leeches on people, and that was what doctors were taught was the best thing to do, and we don't do that anymore. Although we do in some cases do it anymore, because it turns out leeches can be really helpful for people with bleeding disorders, and they can reduce swelling. So I mean, there are things that you discover. So I think the most important thing when you're covering sort of health issues is to be humble about it, and to make sure that your sources are humble about it. It's like, from what we know right now, this is what the preponderance of evidence says. Could always change. Everything could always change. But here's what we're saying at this point. And that I try to sort of keep that in mind. And I keep that in mind sort of in covering policy too. When people are always pushed, like, is this going to pass? Is this going to pass? Is this going to happen? And it's like, looks like it might based on my reporting, but things happen.
Definitely. Well, seeing no additional questions in our Q&A, Amanda, Julie, is there anything you want to, any final thoughts, any final words of advice for our audience here?
No, I
I
think
just want
those
to
were
say
my
I'm
final words of
excited that
advice.
so many people are interested in this topic. It's such an important coverage area, and I'm really looking forward to seeing all the work too that the fellows put out. So good luck to everybody.
Actually, we do actually have some questions coming in. How do you go about health officials incorrectly citing HIPAA to withhold public information? Since
I mean, well, it depends on the circumstance, but that is often. I guess I need to know a little bit more when you say health officials, but hospitals often hide behind HIPAA. I mean, that's like a well-known thing. I would push back with them and say, show me where in HIPAA you can't release this information, or go to if you're really, really bent on getting the information, like go to a legal expert and say, I checked with this, legal expert on HIPAA, and they said that that should not preclude you from sharing this information. I mean, there's a lot of avenues you can take, but the hospitals do routinely hide behind HIPAA.
I've had veterinarians try to hide behind HIPAA. Like, it doesn't apply to animals. I
my
covered it when it
goodness.
passed.
Wow.
So yeah, I know it's super common and it is hard to push back, but you can.
Definitely. Well, thank you, Julie, Amanda, for your time, for joining us again this year, and to our audience for great questions. We'll share a link to the recording soon, along with resources shared during this briefing and key takeaways. The National Press Club Journalism Institute is proud to produce programs like this at no cost to journalists across the U.S. with the mission of powering strong journalism in the public interest. If you'd like to support this work, we hope you'll consider making a donation today. And I just want to reiterate that this program is part of our public health reporting fellowship. I'll share that information in the chat, and that is supported by the Common Health Coalition. There's more information there in that link. And please spare a few minutes to fill out a survey, tell us how we did today, and help us improve our programming. We hope you'll join us on Tuesday, July 21st for our webinar, Mental Health as a Public Health Issue. We'll be joined by Katie O'Connor, a senior staff writer at Psychiatric News who covers advocacy and mental health related legislation. Katie will share how to rely on stats and real evidence in mental health reporting, as well as how to cover systems of care and wraparound services. And we'll share that link in the chat as well, the Zoom registration. Julie and Amanda, thank you again, and thank you all for joining us. Fellows, we'll ask that you remain in the backstage. We will end the webinar for everyone else, but thank you all for joining us. Have a great rest of your day.
Thank you.